My name is Dr. Anita Biswas. I'm a senior sports physician at the English Institute of Sport. I'm also medical consultant for the athlete health team and one of the co-leads for the female athlete health stream with Dr. Richard Byrne. We've been involved with it at the EIS for quite some years now, so certainly since probably 2014, 2015. But the SmartHER campaign itself came into development about 2 years ago, and that was in an attempt to bring all the really good work that was happening around the network together under one umbrella, and that's when SmartHER as a concept was developed. And the aim of it really is to ensure that we're supporting our female athletes as best as we can. There's a number of things that we do, and they aim to cover all aspects of female athlete health. From one of the things that we've done is a lot of education about the menstrual cycle and just helping athletes to understand the basics of what happens to their body through each month physiologically, and helping coaches and support staff to have that basic knowledge so they can then understand the changes that their athletes might be experiencing and learn to work with them a lot better. Another point of that education was very much around encouraging conversation, because it became really clear that one of the reasons why nobody was addressing the positive and negative impacts of the menstrual cycle on performance was that nobody was having the conversation, or a lot of people weren't having the conversation. Athletes weren't talking about it, coaches weren't asking about it, and it was almost that kind of unspoken part of the female athletes. Education is a big part of what we're trying to do, and we've done a number of road shows and more recently recorded webinars for athletes and staff to be able to watch, to give them that basic knowledge and to help them facilitate their conversations. We're covering off areas around menstrual health, but things like pelvic floor health, making sure that athletes understand what is acceptable and what's not acceptable. So, for example, it's commonly considered by athletes that having no periods is a sign that they're training hard enough. And actually, we want to bust that myth, and we're very clear that that's a sign that something's not quite right if they're having no periods. So that's one of the first education points, is understanding what's normal and what's acceptable and what actually might be having a negative impact on their performance. Around the area of pelvic floor health, research has shown that actually things like stress incontinence are way more common in elite athletes than many people would recognise. So we're trying to educate our athletes to not accept certain things around that area. And we're encouraging athletes to get to know their bodies better, so to actually monitor what their bodies are doing and how they're affected throughout the month. One of the other projects we're doing is around actually monitoring itself. So we've developed a menstrual health questionnaire which athletes can complete and can be shared with their team, so that the team can start to understand how their menstrual cycle affects them. And using our AIR app, our monitoring app, we're very soon going to be able to ask daily questions around individual cycles. Other projects that we're involved with are projects around bra fitting, making sure that athletes are wearing the right type of bra, but also the right fit of bra for them. And then there's also some projects around hormonal measurement, which is our MINT project, in connection with MINT diagnostics, using hormonics technology to measure hormones in female athletes. And the idea of this is to help us to understand a little bit more about the impact that the menstrual cycle might be having on individual athletes' performance. One of the big changes that fortunately we started seeing over the last probably even 5 years is a much bigger interest in women's sport. And over the years, a lot of the research has been done in male athletes. And one of the reasons that's happened is because there's been more exercising male athletes historically, then more elite performing male athletes. And as women have been performing at the elite level, what we've continued to do is use the research that we've got from previous years using male athletes to train our female athletes. And now what we consider is that if we're going to get the best performance out of our female athletes, we need to sense check whether that training research is actually appropriate for them. But unfortunately, the thing that makes women unique is the menstrual cycle, and that makes them different from men. And a lot of that research has not taken the menstrual cycle into account. So we think it's really important to start taking the menstrual cycle into account and working with it in a positive way to help performance, rather than seeing it as a negative. We don't see it as a negative. It's all part of the physiology of the athlete. But if we can use their normal cycling hormones by learning more about the individual athletes, what hopefully we can do is help them to perform at their best. I'm hoping it will be the recognition that whilst there are differences, there's also similarities. And what we need to do is be treating our athletes as very, very much as individuals. It would be nice to see that we have a better understanding of how the menstrual cycle may relate to performance in individuals by better quality research, but also by working with our athletes at the elite level with a real bespoke program around the individuals, getting to know them as an individual. And then if we widen that up, I think it can really help the exercising population too. If we understand more about the menstrual cycle in the elite level, that can be related to women who may be put off exercising because of aspects of their menstrual cycle, or poor fitting bras, or stress incontinence, because we're helping to bring awareness to these areas.